Behind these doors lies a crisis hiding in plain sight, one many Nigerians choose to ignore. Across psychiatric hospitals nationwide, patients vastly outnumber medical staff. The facilities are overcrowded, poorly funded, and in some cases, dangerously neglected. According to the World Health Organization, Nigeria has fewer than one psychiatrist per 700,000 people. Most are based in cities, live in rural areas with little or no access to specialist care.
If you have a shortage of psychiatrists and other mental health professionals, what it also spells is that people may not get appropriate care as at when due. You might eventually see, a therapist or a mental health professional, but what is the quality of care that you're getting? We're also at risk. If we get overworked, we can get, stressed out, we can become burned out.
With formal support out of reach, many families resort to religious or traditional healing centers, some unlicensed, where patients are chained, beaten, or starved under the guise of treatment.
If we think that it's bad for people in the urban areas, it's only possibly extremely abysmal for people in the rural areas. And so what you would find is that you'd find people who would exploit that gap, largely because there are no professionals to provide the care. You would see just about anyone and everyone call themselves, quote unquote, a professional, just to be able to provide the care that people need. But unfortunately, what happens at the end of the day is that you might find a worsening of mental health symptoms.
Stigma remains a major barrier. In many communities, mental illness is still seen as a spiritual curse or personal weakness. People delay seeking help often until it's far too late.
When a random person hears therapy or you need therapy, most of them believe that therapy is for people that are having intense mental disturbance, and then when the therapy itself has now become a form of label or an object of stigma.
When we have more information out there, probably through agencies like National Registration Agency, through the health ministry, in different localized languages, it would reduce the stigma significantly.
In 2023, Nigeria passed a new Mental Health Act, a promising step, but implementation has been painfully slow. Currently, less than 4% of the national health budget goes to mental health, and even less actually reaches those in need.
We have to start from the policy perspective, from the government's perspective, by looking at how we want to increase the budget that goes to mental health. Second is the same way we have HMOs giving access to therapy through their third parties and their clients. We should now incorporate therapy into the NHIS scheme, such that public service workers and general Nigerians on the NHIS scheme can also have access to therapy.
Until Nigeria begins to take mental health seriously through proper funding, public education, and trained professionals, millions will remain behind closed doors, untreated, isolated, and invisible. In Lagos, for News Central, Oluwakemi, Alimi.